Welcome back, everybody. Thanks for coming checking out the video.
Thanks for tuning in.
Yeah, tell them what we're about, Mitchell.
Well, hey, thanks for tuning in. Our channel is called Getting That MD, is Getting That Medical Degree for any medical related fields. We're gonna be talking about mostly our channel is gonna be related to applying and getting into medical school since we're in the process of doing that. But Zach has a farm degree, soon to graduate, and I studied nursing. So we're going to be talking about different topics about medical related stuff. So if you're interested, check it out. Join us. We're going to be doing in a couple of weeks. We'll do some interesting topics about nursing, some interesting topics about pharmacology. We talk about a little bit about news and medicine. But yeah, what are we going to talk about today, Zach?
We're going to talk about urinary tract infections. It's a pretty
Oh,
easy topic, but it's easy to get bogged down in the details. So this is why we're making a new series called Diseases Made Easy. So we'll do everything from VAP to UTIs to meningitis. The fun stuff. So get into it.
the not so fun stuff, some people might say.
Yeah, not so fun, but I mean, we'll try to make it a little better.
You're right, right, right. More informative. A little bit
Yeah,
more.
so there's different types of
Welcome to
UTI.
YouTube University.
Yeah, YouTube University, that's a good way to put it. So you have cystitis, which is in your bladder. That's a kind of a easy way to think of it. Took me forever to realize what cystitis was. I don't know why, but did you know what it was?
No, I mean I read it in a book. That's it. That's
Yeah.
literally it.
It took me till the end of my infectious disease rotation to realize it's just bladder and it's a lower UTI. So some symptoms of this is going to the bathroom more frequently, pain when you go to the bathroom, and really just blood in your urine. So pretty scary
That's
stuff
the
though.
hematuria.
It's pretty scary though. Blood in your urine's always a scary time.
You know what's scarier? Throwing up blood. That's a lot scarier.
I guess both are serious, but. Then you have pyelonephritis, which is nephritis, so you can think of that as your kidney. So it's more of a upper UTI, so it's your kidney. And that's mostly just back pain, since that's kind of like your kidneys area. Kind of
Yeah.
goes, you can see it goes hand in hand. Back pain, kidney, nephritis. Then you have vaginal Candida albicans, which I don't see this one at all in my infectious disease rotation. So it's like itchy, white, thick discharge. Sounds terrible to say,
No,
but that's what it is.
yeah, yeah. It is. It is terrible. I've had some friends stories of how it's college, so how they're like itching and they're trying to WebMD everything. So
Yeah. I just pretty much just finished my infectious disease rotation, so that's why we're kind of doing these topics too. And
and this vaginal Candida albicans, this can also, if I'm not mistaken, sorry to interrupt, this can also present in a different way to males. So um sort of like a yeast infection type thing.
yeah, it's just weird. I've never seen a case of this in the hospital, and I've been there for 5 weeks now. So
Really?
yeah, it was always cystitis mostly, and then some pyelonephritis, complicated or uncomplicated. But yeah,
Okay, well, the yeast infection, it's I think it's called balanitis when it's the inflammation of the head of the penis. Yeah. So it's a candida. Well,
yeah,
forgot
yeast.
about it, but go ahead.
Yeah, so that's that. That's the different types. It's kind of important to keep in mind because then we'll talk about treatments. You can think back to cystitis, bladder, nephritis, kidney. So you have acute uncomplicated cystitis. So you have different organisms. So you have Proteus and E. coli, which are the most common. You also have Kleb and Enterococci. So we mentioned in other videos about the coverage of drugs, so why we did that first. So now you can know, okay, E. coli, what we can use for that, Proteus, what we can use for that, right? So even without seeing the drugs on the screen, you can really just use anything like ceftriaxone you could use for this. You could use macrobid or nitrofurantoin. You have Bactrim. That's really it for that. If they're prego, use cephalexin or amoxicillin. And then you treat them if they're asymptomatic and they're
You
prego
still
for.
see cephalexin?
What do you
Is
say?
that what they go for first, cephalexin, or do they usually just go for amoxicillin?
It just whatever, really. Doctor's preference. Yeah, I mean, Bactrim and macrobid or nitrofurantoin are really common to see. Now, if your renal function is bad, which is your creatinine clearance less than 60, you will not get nitrofurantoin at all.
Mm.
But you're supposed to be treating these for like three days, but doctors usually treat for 7, which is why you're
Just to
getting
be on the safe
resistance.
side. But yeah, but that's the problem. You get resistance from it.
That's exactly it's just what you see in the hospital time. Like, oh, send him home when 7 days of Levaquin, which is a fluoroquinolone. That's
And
overkill.
I've seen patients who develop resistance who, after they get reinfected or they get like, exposed to it again, they cannot, the same treatment will not work.
Yeah, it's usually within 90 days of IV antibiotics or antibiotics in general, you see the resistance occur. So,
This is why we're creating superbugs.
yeah, pretty much. And then you have acute uncomplicated pyelonephritis. So you think back, that's your kidney now. So that's your flank pain for your symptoms. And this is your E. coli, enterococci, Proteus, Kleb, and now you have Pseudomonas. Do you know much about Pseudomonas?
Just the basic human anatomy stuff. But
It
now
just
tell us what a Pseudomonas infection is. All I know is that they're caused by a bacteria that is called Pseudomonas that is
yeah.
found in dirt, plants, and liquids, so like water.
Yeah, so for our viewers' sake, Pseudomonas is a bad infection. That's all I really need to know. If you see Pseudomonas come up on the urine culture, since we're talking about UTIs, you should be worried. It's a very resistant organism.
But it can be
So,
treated with penicillin, right? Or
no.
cephalosporin.
There's only, I think, a couple of cephalosporins that cover Pseudomonas. I could be wrong on
Mm.
that. So, for UTI with something like this, you're going to use Cipro, which is ciprofloxacin, so it's a fluoroquinolone. 500 2 times a day for 7 days, so BID is 2 times a day, or levofloxacin 750 daily for 5 days. Now you could use Bactrim for 14 days or Augmentin. That's if it's not Pseudomonas, really. That's outpatient, so that's you're going to the pharmacy
Yeah,
and picking the medicine up. Now, if you're in the
yeah, because
hospital, they're probably using
if it's
Cipro.
serious, it's like serious, serious. You can even can you develop pneumonia from it?
I don't think so, unless it somehow gets out of your urine and goes to the blood somehow. But
Oh, yeah, we're talking about urine. Okay.
yeah,
Well,
this is
septicemia.
it's UTI, so
Okay, right. My bad.
yeah,
We'll make another video.
yeah that'd probably be another one. In the hospital, they really just use ciprofloxacin or levofloxacin. I mean, that's basically what they use. Doctors are very scared of using anything else, so they go to the fluoroquinolones, which is kind of overkill, but that's what they do.
Yeah, they go with the highest super natural killer.
And then you can step down. So if your cultures come back and it's not Pseudomonas, then you can step down and treat for 14 days. But you really want to make sure you're kind of overtreating in the beginning in case it is Pseudomonas, and then step down after you get like your cultures back, which takes a couple of days.
Hmm.
Now, a complicated UTI, so we have uncomplicated and complicated. A male is considered complicated. So
Mhm.
if it's a male UTI, it's automatically considered complicated. So you're already on the stage.
Well, like the thing that they taught us in school is like a UTI in a guy is really hard because the urinary tract it's a lot longer compared to the urinary tract from a female. You have the vagina right there, and the infections can happen right away. But with the male,
It's
it's a
higher
little
up.
bit. Yep. So it's a little bit different. So it's a little bit easier for females to get UTIs compared to males.
Yeah, so like again, you see UTI and you see as a male, it's a complicated UTI, so you're thinking of these organisms. Now, if they have a catheter in, it's going to be complicated
Oh,
as
that's
well.
oh my gosh, yeah. That we have a super high risk of UTIs and catheters,
Yeah,
and
and
even trying to be careful on it.
it's scary. I mean,
We
that's
had we had
changes
a yeah.
everything.
I'm not gonna say that, but yeah.
It just changes everything because now you have bugs that can stick to the catheter. So maybe you think you're treating an infection, but then bugs from the catheter are causing reinfection.
Oh, professor told us that one time that a patient had removed his catheter, and the catheter was on the floor, and it was just a pool of piss on the floor and everything. And they tried to, you know, try to figure out how to clean it and how to go about it. she
It's not
was
good.
completely worried that he was gonna get a UTI, but apparently he didn't. So
That's always good.
yeah, scary.
It's scary. Yep. Pathogens
We
you can
should
see on
do
the
scary
screen, though.
stories. We should do scary stories about stuff that we've experienced in the hospital. That'd be fun.
That could be a series. Oh,
Yeah.
what do you think about that?
All right.
So your pathogens, you see E. coli, Kleb, Enterobacter, Serratia, Pseudomonas. Pseudomonas, again, that's what you're most worried about in these patients. And then you have ESBL, which is extended beta lactamase guys, which means they inhibit all your penicillins pretty much. So like your Zosyn, which is like a common thing to use in the hospital, it's not going to work. So that's why our next video is going to be about that. So the updated
All right.
guidelines. But Bactrim's
Awesome.
your choice, and if it's not in the urine, use a carbapenem. That's one of the videos we're gonna be doing. So we'll go back on that. You have anything to add?
No.
Yeah, we'll see you guys in the next video. Remember to like, comment, subscribe for more videos. Peace.